If you're less than 1% referrals in your office consistently, you have a problem with likability, respect, and value.
Welcome to AMC. I'm Dr. Greg Miller. Have you ever wondered if you actually have a healthy referral practice? Well, today, Dr. Shannon McMurtry is going to share about internal referral stats. You won't want to miss the section about how to assess your new patient referral numbers and what's the best measure of referral numbers. Most specifically, how many referrals should you be getting per 100 visits? Let's go ahead and get started.
Hello and welcome back for another episode of INNATE content designed to help you serve more people successfully and run a healthier, stronger practice or business in your community. If you are new to this content, make sure you hit that subscribe button so you can get the notifications automatically sent to you, keep you in the loop when new content is available. You can go back through the archives as well and see what we've done before. If this is another one that you've already subscribed to, please hit that like button. No, seriously, go ahead and hit that like button and then make sure that you are sharing this with your friends and colleagues in need of this information. Quick introduction. My name is Dr. Shannon McMurtry. Over 20 years as a chiropractor, almost 20 years as a chiropractic coach or consultant for practices all across the country. By the numbers, you can look at a patient. Let me change that. You can look at the numbers of a patient without ever seeing the patient face to face and get an idea of how healthy or unhealthy that patient is, that person is. You can look at heart rate, blood pressure, BMI, and if those numbers are all high, if they're all off the chart, you don't even have to lay eyes on this person. You don't even have to evaluate this person. You've already got some really key indicators that tell you as a physician, this person is not healthy. They are not living and expressing optimum health in their life. The same is true for your practice. You have key indicator numbers that tell whether your practice is healthy or unhealthy. There are three key metrics that I look at to assess a practice, and these are very accurate. I can tell whether the practice is trending towards health or trending towards unhealth from these three numbers. One of those numbers is your referral rate. Now, if you don't know the other two, contact me and I'd be happy to share those with you. But let's talk about referrals first of all. Everybody wants referrals. Referrals are easy to work with. I have yet in my almost 20 years to work with a doctor who says, I'm done with referrals. I don't need any more. In fact, if another referral called this office, I think I'm just going to pull my hair out. It's never happened. We all like referrals. We want referrals. They know who we are. They trust us. There's none of that awkwardness of, are they going to believe me? Do I have to sell, quote unquote, this paradigm of healthcare with them? They come in practically wanting what we have to offer. Their friends have told them, their family have told them all the great things that we've done for that person. So everyone wants referrals. But more importantly, referrals and the number of referrals is actually a metric that indicates how the patients like you as a person, how much they respect you as a professional, as a doctor. And it also indicates how they value the services you provide. So referrals, we want them, but if you dig a little bit deeper, referrals give great insight about the relationship you have with your patients. There are lots of ways to assess whether your referral rate or referral number is healthy or unhealthy. Some people say, or some management folks say, well, as long as you have a good percentage of your new patients coming from referrals, you're in good shape. That's not true, because you could have an adequate number of new patients coming from referrals, but not have enough new patients in your office to grow the office to where you want to be. That's a different set of rules for somebody who is at a stable level of practice. But for that person who's trying to grow and get established, you can't just look at the percentage of new patients being referrals as the indicator. I've heard other people say, well, you want to match your new patients from your promotion over the next 3 months with the number of referrals. So if you go out there and do a screening, or you do some sort of patient appreciation event or whatever, and that event brings in 21 new patients, you want to be averaging about 7 additional referrals over your norm or your average each month over the next 3 months. That's a pretty good number. If I look at an office that does that consistently, they've adopted a model that you promote to gain and you refer to maintain. That's what a lot of us are looking for. We're looking for that office that allows us to maintain some level of consistency month in and month out. That's not a bad metric to go by. So if you like that one, use it. Whatever you're doing from a promotional aspect, you need to match that number of new patients generated over the next 3 months by the referrals that are coming in. And if you can do that, you have a stable practice. The best indicator, the one that I like the most, is an indicator that says, how many referrals are you getting from each unique patient encounter in your office? Every time you have a patient visit, a new patient, a reevaluation, anything that is a face-to-face contact point with your patient, we should be able to look at the number of referrals for each one of those, or ratio that out, like how many per 100 encounters are you getting. I like that one because each patient counter is unique, and you should have some referral conversations with patients on a regular basis. If you're doing that, then you will have a certain number of referrals for every 100 patient visits in your office. So this is my favorite metric. I think it is the most valuable from an assessment standpoint. Let's go through what you should be looking at. First of all, if your office is on the extreme end of the bell curve, right? You're struggling just to find enough patient visits. You're doing less than 50, 100 patient visits in a month. Or if you're on the other extreme and your clinic is doing 1,500, 2,000 visits in a month, the numbers that I'm going to share with you don't necessarily follow that bell curve distribution, but there's still good validity with them. So let's go through them together. First of all, if your referrals per 100 visits are less than 1%, that indicates that there is a problem in that likability, that respect, and that value that we spoke about just a few moments ago. Now, I've worked with chiropractors for a long time, and here's the general rule of thumb. Most of you are not lacking in the likability department. In fact, if we do anything, we go overboard with being likable, and that can be a detriment. That can actually hinder your ability to run a successful business. But if you're less than 1% referrals in your office consistently, you have a problem with likability, respect, and value. And I would actually clue in on more respect and value than I would likability. So if you're seeing 500 visits in a month and you consistently have 2, 3, 4, 5 referrals, there's a problem there with your relationship with the patients. An office that has a 2% referral rate. This is a good number. This is an office that has some ability to influence referrals in their clinic. And I have coached offices on the extreme upper end of patient visits that a 2% referral rate is really about all they can handle. They literally cannot handle more new patients in until they increase their facility size, get their associate in, or whatever. So there are moments where even 2% is challenging for some to get, not because they can't get them, but they just literally have no more room for them. But if you're an average office out there doing 100, 150 visits in a week, you should be able to easily get 2% referrals per 100 patient visits in the office. And that's an indicator that you are in a good state of health. You have the ability to influence referrals in your clinic. Around 3% plus or minus. This is a better referral rate. This is actually a clinic that is self-sustaining, and that's what a lot of people are chasing or wanting. They want to get off the rat race. They want to get off the constant marketing and wearing themselves out and burning out, because they're not a marketer. They're a chiropractor. They want to help people. They don't want to market to people all the time. Well, if you do 3% referrals, you have a good, healthy practice. It's self-sustaining. You should have some consistency month in and month out. Now, that 3% hinges on some of those other numbers that I didn't share with you earlier. Remember, I said there were 3 key factors. If you have the other 2 factors solid and 3% referrals, you're in good shape. 4% referrals or better on a consistent basis. This is the best. This is an office that has the ability to grow through the referral processes. This office requires no external marketing whatsoever. And that is almost like the fantasy land in chiropractic. Self-sustaining. I don't have to do any marketing or promotion outside of this office if I don't want to, and I can even grow the office through my referral processes. If you're having 4% referrals a month on average, you should have the ability to grow that office through your referral processes only. If you're not having that, if you don't experience that in your clinic, contact me today. We have a wonderful blessing, a wonderful opportunity to have a really strong, healthy business, and we're letting it slip through our fingers. I love referrals, and I love how it indicates where we are with the health of our practice, just like the numbers indicate the health of a patient. And I hope that each of you are achieving in that good to best range for the referrals in your office on a regular basis. If you're not, I want you to reach out to me. Maybe there's some easy things that can be done that shift that to a better range. Maybe there's some things that we need to stop doing that are no longer productive. But sometimes you need, just like the patient needs an outside person to kind of tell them what they need to do, sometimes you need that outside perspective to really illuminate where the issues are. I hope this has been helpful to you and for you, and I hope that you have a great rest of your day. We'll see you on the next episode coming up very soon. Bye-bye.
Doc, we've got a live Zoom call on August 12th at 1 p.m. Eastern with more detail on referrals in your practice. Register at amcfamily.com/calendar. AMC is here to help your practice become respected, effective, and valued.